So today's topic is something that I've covered a couple of times, but I'm taking a different angle here now, and it's on how to and what to expect when you book in for a consultation. I think booking in for consultation is the best way to go. You don't have to book in for a consultation appointment, but it's ideal, and I always recommend it for anybody who's cautious about what the work's all about and don't really understand what the work's all about. It's ideal for anybody who sort of just wants to explore their options. I think that's a brilliant way to go to book in for a consultation. It's ideal for anybody who wants to see what the work is about and that they can actually meet with me and see if we are a good fit and that we can work together. I think it's ideal for anybody who has any health concerns, has a medical history or a surgical history, and on medications, whether they're a diabetic, cardiac, whether on blood thinners, have had cardiac surgery, whether an insulin-dependent diabetic, on chemotherapy, or wanting to start IVF, please reach out and have a consultation so this can be fully discussed before you decide to embark down the road of committing to having your eyebrows done. So anybody who books in for a consultation, firstly, you get an email of welcome. Secondly, you get an email on what the consultation is all about and what we will discuss with you at the consultation. And a third email gives you full details on what the whole microblading process is all about. Now, a lot of people say there's far too much detail, but guys, having a tattoo on your face is no small thing. It's not a tint. It can't be washed off. It is something that is quite serious. You sign a consent form and you have to read a 7-page documentation before you sign that consent form. So you're screened really tightly. And when you commit to having the treatment done, it's a 2-step process. It is anything between 4 to 8 weeks apart, and you have to have a minimum of 2 treatments. That's on our website. It's on the booking form, and it's also on the detailed explanation emails that we send out to you. Some people say there's too much information in those emails, but you know what? You're going to know these things. If you look at a harmless box of paracetamol, all the details that you need to know in taking your 2 paracetamol, you need to know what they're for, you need to know why you're taking it, you need to know what the contraindications are, and you need to know it all. That's why we give all that. So you get all that information in advance once you make your consultation appointment. Then, just before your appointment, about 3 days beforehand, reminders are sent out for you via email and by text as well. And also an email arrives on how to prepare for your consultation. And this is so that you can get the best time and the best value out of the 50 minutes that you have exclusively with me, so that you can, in gathering all the information that you need, but we also need to ask lots of questions to make sure that you're a suitable candidate. And in that consultation between the two of us, we actually will see if we've got a similar vision and if I can deliver what you're looking for. So I will need to make my own assessments. You're also interviewing me as well, but I need to make my assessments in making sure that you're a suitable candidate for what we can deliver. So be prepared for the question, how did you lose your eyebrows? It will be either that you've overplucked in the past, or it could be through illness, or it could be totally unexplained. And that is one of the questions. We need to know what is the reason for you approaching to us to have either an improved eyebrow or a totally reconstructed eyebrow. And once we know how you lost your eyebrows, well, then we can execute a plan in order to be able to get the best result for you in determining what is the best method of tattoo delivery will suit your needs best, you and your skin needs best. So in that email that you get about 3 days before your appointment, we advise you to arrive with your current eyebrow products on and how you draw them on, so that we can assess how you like to wear your eyebrows. So bring your pencil, bring your powders, and we want to be able to assess your natural features and how you apply your products, and then that will help us determine which is the form of delivery that's best for you. Screenshot some of the work that you've seen belong to us for discussion. Sadly, some clients are not suitable for the style of delivery that they request. And we need to discuss what's the best technique for you, your needs, your age, your skin, your existing brow hairs, and how you fill in your eyebrows and gaps. And we like you to bring your own pencils so that we would draw on your new prospective brow, given the facial morphology tools that we have. And if we draw it on in the existing pencil that you normally use, that it's not going to be too much of a colour shock. I use a black wax pencil normally in my work, and it can be very disconcerting and too dramatic for you to go home in a black potential brow. The shape will be gorgeous. The shape is the most important thing, but I usually ask you to leave the pencil on for the rest of the day so that every time you glance in the mirror that you make some mental notes as to what changes you might like to make when the day comes to have the work done. And it's, yeah, you don't want to be walking around town with a black brow if you are a very light-haired client. Now, most people absolutely love it because the pencil that we use is, it has a very, very thin pen. A very thin tip, and people love it. Anybody, brunettes, dark brown hair, black hair, they love it. But anybody who's lighter colour might find it a bit disconcerting. Please do not apply fake face tan on your face for 4 days before you arrive. It gives a misleading colour tone and to your skin, and it could affect the pigment choices that we make. Part and parcel of that information pack that you get in advance is certain precautions. So clients who are on prescriptive facials or prescriptive face products, people who have had microdermabrasion, these are special precautions now. Clients who are planning on having Botox done, clients who are taking fish oils will need to be able to plan around booking in their step one. We don't want you taking fish oils for a week beforehand. You're on a beautician prescriptive skin regime with products, please bring the products with you and the reason why you're on them. We've had problems in trying to penetrate the skin and do our delivery of work, and it has been difficult because clients have been prescribed certain oral skin boosting enhancement boosters, and they would have worked extremely well, particularly brides, for example, who want to make their skin lovely and bright for their wedding. And it does a great job in doing that, but it actually makes the outer layer of the skin very difficult for us microbladers in order to penetrate the skin, in order to get our little microblade under the skin. And we have found over the years that the skin and the needle just bounces off the skin. So it does a great job in doing what it needs to do, but we will have to seek your permission to reach out to your beautician or your doctor, particularly if you're on retinoids, to discuss your skin in certain creams will need to be discontinued around the brow area a week before treatment with us. So we advise our clients to stop using products that contain vitamin A or acids or polyhydroxyl acids a week before treatment, because this can cause sensitivity of the skin. You need to make a list of any of your health ailments that you have, your list of medications, if you are a diabetic, insulin dependent diabetic, if you have cardiac issues, and if you're immunosuppressed, we need a doctor release letter, and you will need that in advance of the treatment. And it's great for you to be able to sort of get those permission slips in advance rather than delaying the whole process even further while you're trying to acquire them. If you've already gone down the road of Botox, particularly in your forehead, we need for it to be settled a minimum of 4 weeks, or you postpone your Botox until you've had your treatment done with us. And if you have a latex allergy, well, you don't need to worry about that. We would ask you anyway, but we use nitrile gloves anyway in brow cheeks. So if you are or have health issues, you need to seek out your GP or your dermatologist's permission before even booking in, because we will be advising you to do that either way. And once we have permission from your doctor or your oncologist or your dermatologist, well, then we can rock on. Sudden, unexplained eyebrow loss is not normal. and that cause needs to be explored with the experts. So like, we will help in creating a new eyebrow, but we can't diagnose how you lost them in the first place. So you need to ask your doctor, your GP, and other cases as well, like keratosis pilaris, for example. That's kind of like a roughness that you get around the orbital bone. It's kind of like chicken skin, a bit like eczema. Sometimes it's insidious in the sense that you can't see it, and it doesn't become apparent until we're actually doing the work. But if you had keratosis pilaris, it's a difficult treatment to execute, because the skin tends to be a little bit rougher around the orbital bone here. But this will determine, doesn't mean that you can't have it done, it'll determine the technique of the eyebrow tattoo that'll be used and what type of tattoo is best suited to this type of skin. So I hope that helps. Having a consultation isn't coming in to have a chat. Yes, it is. We do converse and we exchange information, but it's very important that I need to collect a certain amount of data, and you're also interviewing me to see if I'm the person for you and your needs when it comes to your tattoo. But it is an unregulated industry here in Ireland, as you know, and if we don't do the screening process, then our insurance won't cover us. And that is one of the beauties of Browteak Ireland. As registered nurses, we will execute your tattoo as safely as we possibly can. And given that our expertise and our professionalism as nurses, we will do our best for you. If we can't help, we won't harm. Okay. And then after that, our skill as eyebrow tattooists, we will deliver the best form of eyebrow tattoo that is suitable for you, your skin, and what you're looking for. So, I hope that helps, and I'll talk to you soon. Have a great day. Bye.